Morning. We are happy to have our first town hall virtual meeting. Many of you have been with us for months. We have been holding virtual meetings since April. And so we decided to return with a very similar format, but with some different guests. So today we have Dr. George Garrow, who is the Chief Medical Officer for Primary Health Network. We're going to learn a little bit more about Primary Health Network today. And we're going to have Dr. Garrow help us with getting to know the services his team offers and how they're navigating the pandemic, and then his personal reflection, of course, on how we move best forward. We're excited to hear from him. I want to remind you, as we've been reminding you for months, that we're doing the best we can to bring you great information, good information that you can depend on, that is that you can use in your workplace and with your family. But that information is changing quickly. So we want to make sure that you understand that everything we share right now could change within the hour, by this afternoon, or in days to come. So we are very happy that Dr. Garrow is willing to share with us. So we'll go ahead and get started here in just a minute. I do want to remind you that if you have questions, you can put them in the chat. We will do our best to get to those questions. What we don't get to today, we'll be happy to follow up, perhaps even do another one of these. So with that, let's go ahead and get started. So Dr. Garrow, welcome. It's good to see you this morning.
Thank you, Susan. It's good to see you as well.
Can you tell us a little bit about Primary Health Network, some of the history, and about your office, your presence here in Venango County?
Yes, ma'am. Thank you. Yes. So first off, as we begin, for the individuals that are on the call on a personal level, I would like to offer and extend my sincere wish that you and your family are healthy and safe. This week, we're going to be celebrating Thanksgiving, and perhaps this year more than ever, I realize that giving thanks is really critical. And even though it may not seem that there's much to be thankful for, I know that in my own life, there is a lot to be thankful for. And I'm thankful for the opportunity to be with you this morning. So, yeah, I am actually the Chief Medical Officer at Primary Health Network. Primary Health Network is what's known as a community health center or a federally qualified health center. And the mission of organizations like Primary Health Network is to provide access to high quality primary care services, regardless of a person's ability to pay. We don't turn anybody away. So if individuals have commercial insurance or on Medicare, we take great care of them. And if they're on Medicaid, we love them and we take great care of them. And even if individuals are uninsured, we love them and we take great care of them. We offer what's called a sliding fee based upon the household income. And so the cost for the visit, could be substantially discounted and potentially even zero based upon income. Now, our history in Venango County, we actually have been there about a year. I believe we opened in 2019. And we were actually invited to come to the community, recognizing that there was a need for our services there. We have a very good working relationship with our colleagues and friends at the hospital. And we're having conversations with them about, the need to provide primary care services, behavioral health services in Venango County. And so we actually opened our office in your beautiful city of Oil City, and there it is. And we've really enjoyed being there. We actually also have a partnership with Darling's Pharmacy. There's a pharmacy and association with our health center. And what's interesting about our pharmacy relationships is that there's a federal drug pricing program that's called 340B. And for our patients who get their prescriptions from a PHN provider, there's the opportunity that their prescriptions could be obtained at a significant discount. So I have been to your beautiful area several times as we were opening the site, and we're thrilled to be there, and we really welcome the community opening their arms to us.
Well, thank you. We're so glad you're here. What a wonderful resource for us to have. And you mentioned the hospital there. Can you talk to us just a little bit about how you partner, where you refer to If we have established relationships here, we have a favorite hospital. Can you tell us how that works? If we
Yeah, sure.
become
Yeah.
one of
So,
your
yeah, we are entirely ambulatory. We're entirely outpatient services. And so if a person needs diagnostic services, radiology, laboratory services, if they need a referral to a specialist, or if they need hospitalization, we, really work very closely with, really all the hospital systems in the area. We have, as I mentioned earlier, we have great relationships in the community already. And I often say to folks, we're Switzerland. We really want to get along with everybody and anybody. And we really put the needs of the patient first. So if patients, members of the community, have a relationship with a specialist or relationship with a hospital, and that's where they need to go, we make it happen. We provide a warm handoff, make sure the information gets passed along, really to provide the best care possible.
Great. Well, that's good to know. It makes it even easier to use the services. So we have spent the last 9 months trying to understand COVID-19 and how to minimize the impact on our community. We did really well for a while, but of course numbers are rising. There are still so many unknowns and so much uncertainty. We'd love to hear from you as a healthcare provider. What did we do right, and what should we be doing better right now?
Yeah. Yeah. So, the 2020 has certainly been a challenging year, right? And I'm a student of Latin, and in college and medical school, I kind of dabbled in understanding Latin. So I've gotten to the point where I'm calling 2020 annus horribilis. It's been a horrible year. And in particular, the impact of COVID on our communities, on our businesses, our families, our relationships with one another. So in many ways, I think we've done a lot of really amazing, good things. I think what we're doing this morning, applying technology like virtual meetings and telehealth visits in our offices, has really been a very good thing. It has allowed us to try to stay connected. It's not ideal, but it's, really better than, being isolated and alone. So I think that's actually very good. I think I have seen it bring communities together. I applaud Susan and the work that the Chamber is doing to try to help to keep the community connected during this difficult time. I think some of the opportunities for us to continue to improve and to mitigate the spread really circles around what I call Public Health 101. They taught me this on my very first day of public health classes, that when there's a contagious disease in the community and your environment, there are just some simple things that we could do to help prevent the spread, whether it's COVID or whether it's influenza, anything, is wear your mask, maintain social distance, avoid large crowds, wash your hands, and make good choices. Wearing a mask, in my mind, is being kind. When you wear a mask, it shows others that you care about them, and you're wearing your mask to protect them. And maintaining social distance means I care about you. I want you to know that I am doing this because I care about you as a fellow human being, as a person. And so, as we go forward, I believe that we've been on this pandemic adrenaline, filled 9 months. And even as the vaccines become approved and enter our ability to provide vaccinations, recognize that this is not going to stop. We're going to need to continue this and be very vigilant about this really into the good part of 2021. And so I've been thinking of it as more of an endemic response. This is something that we are just going to have to deal with use common sense, and we're going to get through this together. But we need to also pace ourselves and take care of one another and be supportive of one another as we get through these challenging times.
This is what I'm going to add another little kind of add on to that question. So we've heard loud and clear masks and distancing, lots of hand washing. There will be families gathering around the Thanksgiving table, can you help us with what I know the best thing to do is to try not to gather. For those who may say, I just have to be with my family. What are kind of the best, what's your best advice?
Yeah, that's a great question. So, um, and I'm going to tell you what I said to my own family is just to be honest, recognize what are your feelings? Are you anxious about being together with 14, 16, 20, people in a household? And if that brings you anxiety, be honest about that and talk to your support group and talk to your loved ones and your family about how you're feeling. And I know that in the Garrow household, we're kind of embracing that this Thanksgiving is going to be unlike any Thanksgiving we've ever had. And so we're going to embrace the difference. Vive la différence, right? So we're going to do things a little bit differently and shake it up a little bit. And I truly believe that next Thanksgiving, if we do this right, next Thanksgiving will be unlike this Thanksgiving and we can go back. I think it's also important to be honest that if deep in your heart, you feel that you need and want to have that presence with your support group and your family and your loved ones, you need that time. Okay, well then do it, but do it smartly. Maintain social distance. Wear your mask when you're in the house, except, for when you sit down to eat. Space the tables out. A neighbor, a friend of mine has actually put, a big long table in their garage, and you got to clean out the garage, and they're kind of having this, long extended table so that they could be socially distant and it sort of embrace the differences. If a guest or if someone is coming to the gathering and they're experiencing signs and symptoms, it's probably better that they, don't come. Take care of yourself. Please
Take
stay
a
away.
to-go plate, maybe fix a to-go plate.
Fix a to-go plate. My
Yeah.
sister who loves to cook, decided that that's what she's going to do. So she's planning to cook, and then she's going to put all of her to-go things outside. Her kids are going to come and pick it up, and then they're going to have dinner, eating all at the same time on Zoom, in their own respective houses. So yeah, be creative and have fun with it.
There have been lots of Thanksgivings in my past where we took a nice walk in the afternoon, and it'd be a great day to get outside. It looks like our weather might not be too bad this year.
That's what I hear.
Yeah, well, our positive cases just seem to be exponentially increasing here. I mean, every day the news is worse. As in other communities across the state and the nation. Now we're approaching flu season. Can you talk to us about, what is the challenge, particularly for you in the medical field, but for us out here, how do we know? Do I have the flu? Do I have the regular flu? Do I have COVID? Do I have a cold? What should
Right.
we know?
Yeah, so really the signs and symptoms of COVID and the signs and symptoms of influenza, are very, very close. And it's really very difficult to necessarily distinguish between the two. My advice for the folks on the call is if you're experiencing any of those signs and symptoms is to reach out to your healthcare provider. Describe what your symptoms are. It may be very difficult to discern or distinguish between influenza and the flu. The difference is that we do have an approved treatment for individuals who have the flu. It's a medication called Tamiflu. And in years past, the CDC and the health department have said if influenza is prevalent in your community and someone presents with these signs and symptoms, that we could probably just empirically treat them with this Tamiflu. We don't have a similar treatment yet for COVID. I think prevention is critical at this time. And, the one thing that we know that can certainly help to prevent influenza in our community is a flu shot. And I think this year more than ever, getting a flu shot it shows that you're being a good neighbor. When you get a flu shot, you're helping to prevent somebody else from getting the flu as well. And by being a good neighbor and you get a flu shot and you don't come down with the flu, that actually helps my brothers and sisters that are working in the hospital. And, we're not overtaxing the resources in the hospital so that they can care for, others that have COVID or other medical conditions. So, I think prevention is critical. And interestingly, in South America, other countries across the globe whose flu season precedes ours, what we have learned is that there's been less flu in those communities in 2020. And I think that that's an indication that our mitigation efforts, our public health 101 efforts, really do work. Wearing a mask, washing your hands, maintaining social distance not only can help prevent the spread of COVID, guess what? It helps to prevent the spread of flu as well.
Yeah. Well, I've been wondering, so this is a little additional question. We're hearing that our healthcare providers are overwhelmed. There so many people are calling with questions or things that may not be COVID or may not be life-threatening. If I'm an otherwise really healthy person, and I start to get cold flu symptoms, do I have to call the doctor, or would it be just as good for me to just quarantine and kind of see what happens? Is there a point at which I absolutely need to call or see my doctor, or is it safe to just stay in and stay safe?
Yeah, and again, it's variable. I think for each individual, it sort of
Sure.
depends what your clinical situation is. Susan, you're young and healthy, and so even if you were to have influenza or COVID, the likelihood that you're going to be fine is pretty good. But there are others in our community that are more vulnerable, that the elderly or individuals that have chronic health conditions. And the reason we want to know is it COVID is because of that contact tracing. And if I'm a known exposure to someone who tested positive for COVID, then I need to quarantine, and sort of widens that circle. So having said all of that, I would say, if your signs and symptoms are consistent, and you're at some risk, or you need to know that so that you could protect the others around you, don't reach out to your healthcare provider. But anytime a person is not feeling well, even if it's a little sniffle in the cold, you know what? Stay home. Don't go to the workplace. I mean, and I've been as guilty of that as in my lifetime, because I'm going to suck it up. I'm going to go to work no matter what. Well, you know what? That's really probably not.
Yeah, same. I've bragged about that a lot. Yeah, I was brought up in a home where at least go half a day and see how you do, and if you make it through, great.
Right.
While you spread your germs all over.
Right.
So
yeah,
we're really learning some new things this year. I think we can be grateful for that. I do want to dig into the testing a little bit and talk about that. But if I haven't gotten the flu shot and I need one, best advice, should we go to our primary health provider or to our local drugstore? It kind of varies community to community or person to person.
Yeah, all of the above. A good flu shot is a flu shot that's been given, and it's not too late. To get a flu shot. We know that our flu season, really kind of kicks into high gear around the holidays, around Christmas time, into January. It's not too late to get a flu shot. Primary Health Network can give them. You can go to local, drugstores are giving them. Any opportunity to get a flu shot is a good opportunity, and to take advantage of it. And I would encourage you to kind of be a flu shot ambassador with your friends and your families and your groups, and to say, what, getting a flu shot means that I'm being a good neighbor, that I'm really doing what I can to not overtax the already strained healthcare system.
Yeah, I've actually heard that there are some people that for one reason or another can't get a flu shot. So the responsibility lies on all of us that can to protect them. So,
right.
Well, there is certainly frustration over COVID testing, the lack of it, long lines. We're hearing about positive and negative results that are false. Can you help us with understanding what are the types of tests, and when should we get them? Is there a perfect time? Should we get more than one? I have lots of questions, so I'll let you get started, and then I'll kind of follow up if there's things that I'm still hoping to learn.
Okay, that's a deal. So let me talk just a little bit about the different types of tests and what they mean. And so I'm going to start with one that you may have heard about. It's called the antibody test. And it's a blood test. And for the non-clinical people on the call, when I have an illness, when I have an infection, as I recover from that infection, my body builds proteins, antibodies, to help me fend off that infection again in the future. It leads to immunity. And for many conditions, we actually can measure the antibodies in the bloodstream. It's the way that we test for exposure to hepatitis, et cetera. I mean, we've been using antibody tests for diagnosis for a long time. There's also an antibody test for COVID that looks to see if you've recovered from COVID, we'll often see these antibodies in the bloodstream. Now, the problem with the antibody test is that it can be nonspecific. COVID is just one member of an entire family called coronavirus. And so the antibodies that you see could be related to recovery from COVID, or it could be related to recovery from another type of coronavirus. As a clinician, I don't know what to really do with that antibody test, right? It doesn't really tell me, other than you might have had COVID at some time in the past. I think the one role for the antibody test is that if someone is recovered from COVID-19 and they have a good bit of these antibodies, then they could be a candidate to do what's called convalescent plasma donation, where the Red Cross will take the blood, the plasma of someone who's recovered from COVID, extract these antibodies, and then they can infuse that and give that to individuals who are in the intensive care unit to see if that can actually help to shorten their illness and hopefully help to a speedy recovery. Generally speaking, antibody tests are pretty limited at this time. Now, the gold standard test in my mind is what's called a polymerase chain reaction, or PCR. This technology has been around for a long time. And what happens is that we actually extract genetic material inside the virus and actually take it to the laboratory, and then we amp it up. And so we can actually detect, even small little amounts of the genetic material. We amplify it so we can see that it's there. And the PCR test is the send-away test. It's not the rapid test. And it's generally collected by a healthcare professional with a nasal or a nasopharyngeal swab. And the reason we do that is that that's where the viruses come from, is our nose and our mouth and our saliva and our mucus. That's why we wear a mask. So the PCR test, the send-away test, is very, very sensitive, very sensitive. And a positive on the PCR is you pretty much, you got it, right? There have been some reports of false negative in the PCR test, but that's actually very rare. In most instances in my practice, what I have seen, a false negative means that we didn't get a good specimen. You really need to, make sure the specimen is well collected. So that's the PCR test. And those results, when they're done, after the swab is collected, take a little bit of time to come back. The laboratories, the commercial laboratories that we send these specimens to, are overwhelmed. And a few weeks ago, we were getting our results back in about 3 days. Now it's closer to 5 days, just because they're so busy. The rapid test is what's called an antigen test, and that actually looks for the viral particles, the things that are on the surface of the virus. Rapid tests are quickly turned around, and you can get the results in a relatively short period of time. The problem is that there is a somewhat greater risk of what we call a false negative. So you could actually have the virus, and we just aren't able to see it on these rapid tests. So what I have been recommending is, if someone has signs and symptoms worrisome for COVID, we'll start with a rapid test, right? Maybe, if it's available. Start with a rapid test. And if it's positive, we're done. You got it. We're gonna go with it. We're gonna quarantine you. If the rapid test is negative, I'm gonna ask you to let me do the PCR test, because that's really, that'll tell us whether you have it or not. Regardless of the test, it's important that folks need to quarantine until they get their test results back, right? And I have had a lot of questions since Dr. Levine and the health department issued recommendations regarding testing before traveling. And, I think one important lesson, if you decide to go the route of getting a negative test before you return to Pennsylvania, you're supposed to get it 3 days before you come. You get the test, you got to hunker down. You got to basically quarantine, because could have had a negative test, and then you walk out of the place where you got the test done and you could be exposed and turn positive. So that window of time after you get a test until you get it negative, you really have to hunker down and quarantine, or else the test doesn't mean anything. Now, access to testing is getting more challenging. Primary Health Network is doing some limited testing in some of our sites. We had been working on a partnership with the health department and an organization called Latino Connection to bring a mobile approach to testing to your beautiful county in December. Unfortunately, as the case counts have exploded across the state, both the health department, Latino Connection, and Primary Health Network have kind of had to reconform that. I believe that the best test is one that's available when you need it, and that it's accessible. And so, as you know, whatever testing strategy that we come up with, we want to make sure that it meets the needs of the individuals in the community. A test scheduled on a particular day may not meet the needs of someone who needs a test, a week from now.
Great information. I've seen some really good visuals of that kind of when to test and such. So maybe we can find some of those, run them by you, Dr. Garrow, and post on our website. Certainly. So we can show people kind of how that works. Yeah. I am curious. I have a niece in Wyoming. Their governor has approved spending money on home tests. She's getting home tests delivered. I've actually had a local health provider suggest you could order them. Any merit at all? Any reason why anybody should spend any money getting an at-home test? Do you know anything about those?
Yeah, so again, I mentioned this a little bit earlier. The test, the interpretation or the accuracy of the test is only as good as how the test was done. And one of the things that I worry about with the home test is, are you really getting, a good specimen? And I don't know if folks on the call have had the nasal test done. It is not fun, right? You really got to get it up in there. And I know that if I had to do it on myself, I'm going to cut corners and I'm not going to get way up there because it's not pleasant. So my concern with the home testing is, will it give a false sense of security? Oh, I'm negative, so I could go out. I think, again, a positive is a positive. So if you do the home test and it's positive, you need to quarantine. If you're having symptoms and your home test is negative, guess what? You should probably quarantine until we know.
Yeah. Great advice. Well, thank you for that. So you're touching on that whole quarantine thing. So that's complicated too, a little bit. I mean, I guess the best advice probably is just when in doubt, quarantine, but we're all trying to figure out these numbers. We've heard 14 days, we've heard 10 days. Can you tell us, when and how we should quarantine? Is there anything that can help us kind of navigate still being able to do the things we either need to do or want to do?
Sure. So there's actually two types of, I'm going to define two different things. There's quarantining, which is mean you you're a monk, you really need to buckle down. And then there's isolation, where you just kind of do public health 101 a little bit more aggressively, wear your mask in the house if someone in the house is sick, et cetera. So quarantining and isolation. So for a person who is a confirmed positive for COVID, we recommend 10 days of quarantine from the onset of symptoms. And the reason for that 10-day window is that we believe is how long you could be potentially shedding relatively contagious viral particles in your mucus, in your saliva, et cetera. But it's important that 10 days doesn't always mean 10 days. Clearance to go back to work, to go back to school, to come out of quarantine, not only means the calendar goes 10 days, but you need to be afebrile, have no fever, and your symptoms need to be clearly getting better. Because some people that have severe cases of COVID may shed the virus a little bit longer. And so 10 days with absence of fever and improving symptoms. So 10 days if you're known to be positive. Now, 14 days is the recommended time of quarantining if you were a close contact with someone who is COVID positive. So why the extra 4 days? Well, if I was exposed to someone who's COVID positive, I may not develop COVID for another 3-4 days. So that's why we tack on those 4 extra days for me to quarantine if I was a known close contact, because it might have taken a few days for it to kind of get into me and really do its thing, right? So that's where the 14 days come from. If you're a close contact with a known positive COVID person, we recommend 14. Now, where it gets really complicated is that if you're a caregiver for someone who tests positive, they live in your house, they're a household contact, and you need to care for them. So you need to quarantine along with them for 10 days, and they can kind of, potentially leave quarantine, but you need to quarantine for 14 more days because it's possible you didn't get COVID until day 10. So we tack on those 14 extra days.
Wow.
So it's really complex.
Yeah. I've said from the beginning, the worst case scenario is, that we or our loved ones get sick. And of course, worst case is that we pass because of COVID. But boy, the inconveniences in between are something none of us want to play with, right? We all want to try to do our best to feel safe and to be able to keep doing the things we need
Right.
to do.
And I'm also very mindful of those in our community that maybe don't have access to the same resources, the disparity, in the community. And just last evening, I had a very, very heartfelt call from one of our physicians who has a family and they need to quarantine. And they reached out to the physician saying, I don't have any food. I can't go to work, so I have no income. And I had asked Susan and Ashley before the call, and I'm so pleased to hear that your community, your county does have resources available to individuals who are impacted by the need to quarantine, and would encourage those on the call to, follow up with the chamber, make sure that, if you are aware of somebody who's struggling with these social factors during this challenging time, we need to be there, to help to support them. So I thank you for making that resource available.
Yeah. Well, our partners in the community are just amazing. So I feel very, very confident in saying that the community is prepared to meet the needs of those who need it. So we can help make those connections. I think thankfully most people that live here are aware of where those people are. Before we move on, because I want to talk about vaccinations, and I saw a number of questions I'd like to ask. We have a few from Facebook, so I'm going to review those real quick and see if we can ask you to address those. I know they have to do with testing. And I will remind our listeners, unlike our previous virtual meetings that were limited to a half an hour, we're going to take extra time today because there's so much information to share. So if you'll hang with us, we'd love to continue with Dr. Garrow. So one is, where can people get tested in Venango County? The people without symptoms who have COVID are the ones that we think may be spreading it. People here need access to testing. I'm not sure, Dr. Garrow, if you know the answer to that. From my seat, it kind of looks like those are through our local healthcare providers. Can you talk about that?
Yeah, that is correct. And so my advice would be to work with your primary care physician, your local provider. If you don't have a PCP, certainly we can establish you via telemedicine at our primary health network location. And what we actually have done, because this is such a struggle for folks in rural communities across the state, is we then have a team to try to navigate a patient to the testing option that really makes sense for them. Again, accessibility, availability, convenience. So we actually have a library of testing resources, and it may not be with Primary Health Network. It could be with a local hospital. It could be with, I know that pharmacies are beginning to do some testing strategies. So, my advice would be, connect with your provider. They'll guide you to what test is right, and where to get it, that it makes sense.
Great. And I would imagine part of this question is, and to my knowledge right now, if you're asymptomatic, there's not a great solution in Venango County. You're probably going to have to travel to one of our neighboring counties, which I'm not even sure that there's walk-ins at this point. Some you have to make an appointment. There's starting to get to be more of a delay. Last I knew, our county commissioners were at least exploring whether or not we could get some additional testing that would reach the general population. So certainly as soon as we know any of that at the chamber, we'll do our very best to share it in our social media, through our Facebook, through emails. So, and I'm sure all of our local media will do the same. We have another question. My daughter contracted COVID-19 in July and her antibodies are already gone. Has there been testing on the longevity of the immunization effectiveness?
Right. Yeah. Great. Very great question. So I'm sorry to hear that your daughter had COVID, and I hope she's doing well and recovering. So yeah, we've been hearing a lot about the transient nature of these naturally occurring antibodies. And that, again, that's not unique necessarily to COVID. There are a lot of other conditions where these antibodies kind of wane over time and go down. In my conversations with the CDC and the health department, what's actually really unique about Operation Warp Speed and the COVID vaccine is that it's a 2 vaccine strategy. So think of it that it's, you get the first vaccine and then 3 weeks later you get a booster. And our thinking is that it really kind of puts the immune response into second gear. It kind of puts it out there a little bit. So you get the vaccine, you start to mount antibodies, and then 3 weeks later, we come back and we give you a second one. And the preliminary evidence is that adds to a longevity in those antibodies. So that's sort of the strategy behind this sequential vaccination. And that's what we do with other conditions like tetanus and, pertussis, where you get those booster shots. So a great question.
I'd imagine it's safe to assume that we'll continue to learn about the vaccinations as time goes on too, that things will change as we learn.
Yeah, absolutely. Stay tuned. It seems to be changing daily. I'm very, although I haven't seen the raw data, I've had, very good conversations with my partners, colleagues at the health department, and the vaccines look to be very promising, very, very promising. And I would tell you that I have classmates that I went to school with and contemporaries and friends that actually have been working for, some of the pharmaceutical companies that are developing the vaccines. And it's almost been, it's probably even more than the Apollo Moon launch. These folks have been working nonstop, around the clock. They've been putting in long hours to help us to get, the vaccines out here. And someday there's going to be a great movie made about the COVID vaccine. And I bet Tom Hanks will be.
Yeah. Well, I think he went through it early, so he would be the right one. Right. So here's a little longer question. Let me read this for you. If Venango County has gone from 88 cases at the end of September to 750 cases yesterday, what does that mean in terms of the likely untested to date numbers? That is a lot of spread, 10 cases a day in just the last 2 months. That means that over 700 plus cases, many of that number are active, correct? What are the chances of being, what are the chances that there are more cases are pretty significant?
Yeah, I think, and this is not unique to Venango County. I think any of our other counties across the Commonwealth of Pennsylvania, urban or rural, we, at the very outset, we didn't have, necessarily good testing options. So a lot of cases went undiagnosed. We also know that asymptomatic carriers, asymptomatic spread is out there. I truly believe that, we've all probably passed somebody in the grocery store that maybe is asymptomatic and shedding, and they didn't know it, we didn't know it. But I also feel that that's where Public Health 101 really comes into play. And wearing your mask, washing your hands, socially distant, doing all of those things, can we hope help to mitigate the spread? Because you're absolutely right. It's very possible that, there are many more asymptomatic individuals out there, and just make good choices.
Yeah. And this, I think you've kind of addressed this, but the one last question out here on Facebook right now, I think it bears repeating. If you find someone you have been around has COVID-19, what is the period of time they have been contagious to you? So just kind of another
Yeah. So when we do contact tracing, to someone who has tested positive for COVID, we ask them to think back 48 to 72 hours before they became sick or before they knew that they had COVID, and identify people that they were in close contact with. And close contact is defined by being less than 6 feet for longer than a 15-minute time span cumulatively over the exposure. And we also ask questions about, were you wearing a mask and were they symptomatic? And we use that to kind of create a calculation, an estimate of what that person's risk would be, that contact risk would be. And then those people that are considered to be at high risk for exposure, less than 6 feet, longer than 15 minutes, no mask, we tell them to quarantine. So the contagiousness, we believe, goes backwards 2 to 3 days before the person develops symptoms, and then extends for up to 10 days after they have symptoms. So
what about the asymptomatic person? If I do just a precautionary test and I find out I'm positive, is that 48 to 72 hours still hold? I mean, where do I base that?
Yeah. So if it's a symptom-based contact tracing, we say a couple, 3 days before you develop symptoms. If it's a test that's done for screening, asymptomatic, whatever, we still go back a couple of days because we concerned that you might have been shedding the virus for 72 hours.
And we don't know when symptoms might start. I mean,
Exactly.
I had a cold a few weeks ago, and it was like at 1 o'clock in the afternoon. I took my first sneeze. I went, oh my gosh, I've got a cold. So sometimes those show up without any advance warning. You know your symptoms. Great. Well, let's talk a little bit more about vaccines. You referred to it. Can you just add a little bit more about what you understand about its effectiveness and availability? Like, we're all hopeful, we're excited, like how soon can I get it? And should I just do what my doctor says, or should I try to get one vaccine over another? What do you know about vaccines?
Yeah. So folks, I think that the impending approval of the vaccines really marks the end of the beginning chapter of COVID and the beginning of the end chapter. Even once the vaccines are approved and administered, we're not done with Public Health 101. We're still going to need to mitigate until 70% or more of our population is vaccinated, for sure. So we're not done when the vaccines come, but it's the beginning of the end chapter. My advice would be to follow the directions and guidance of your healthcare provider. We have been told to expect potentially approval of the first vaccine maybe within the next 2 to 3 weeks. A second vaccine will probably be approved towards the end of December or right after the first of the year. We will be told, as clinicians, we will be told the priority system for who will be vaccinated first. I believe that essential healthcare workers, patient-facing healthcare workers, nurses, doctors that work in hospitals, intensive care unit will probably be priority one. I also believe that individuals who may be more vulnerable to complications from COVID, the elderly, folks with chronic health conditions, diabetes, et cetera, will probably also be in the first tier. And then as the vaccines are rolled out and manufactured, it'll be opened to more and more people across the community. I would encourage everybody to rely on the guidance of their trusted healthcare provider. They will know your background, your medical history best, and we'll be able to guide you, to the best vaccine solution for you. The great news is, again, based on the preliminary information that I've received, the first 2 vaccines that are likely to be approved have an efficacy success rate of greater than 90%, approaching 95%. It's fantastic. Wow.
Yeah.
Relatively, they appear to be very safe. We hear anecdotal, things happen, but generally speaking, these vaccines seem to be, they got it. It's effective and safe. So I can't
Best
wait.
news. Yeah, it's
I
really
know.
some
I
of the
can't
best
wait.
news we got this year. So I just another quick add-on question to that then. I've been guilty in the past at times of, I'm feeling great. I don't need to see my doctor, and letting myself go years between. I suspect that I have friends that haven't been to a doctor in decades because they've been healthy. Now is the time when we all want to call our favorite doctor and say, hey, can I have some questions, or can you give me some advice? Is this a time when we should be making sure we have an established relationship with a healthcare provider? And my maybe only thing I'd tack on is that going to overwhelm our system? What is our best approach to making sure that we have adequate healthcare, even if we're really healthy and doing the right things?
Yeah, great question, Susan. So my advice is, now is the right time. If you haven't, been checked out, now's the time to do it. I had a conversation with a colleague from another state, and we were sort of comparing our experiences. And it's fascinating that it seems that the impact of COVID, the complication rate for individuals who come down with COVID is much greater for individuals who have diabetes or have poorly controlled health conditions. And so now more than ever, it's really important to just get a check-in, and, am I okay? Do I have any health condition that I need to get that tuned up? Because we know that if you're healthy and you get COVID, you're going to do far better than if you have an undiagnosed illness and get COVID. And then secondly, as this chapter moves from the end of the beginning to the beginning of the end, you want to have a relationship with a healthcare provider that can give you good, solid advice as to how to navigate through this whole process. And I would tell you, we talked a little bit earlier about, being good neighbors and on the lookout for my brothers and sisters that are working in the hospital. And what was it? Ben Franklin, I don't know if he said it or my mom, an ounce of prevention is worth a pound of cure. If we can make sure that we're all healthy now so that we don't need those resources in the hospital, our neighbors in the hospital and the patients in the hospital are going to thank us.
Yeah. Well, it's so easy to lose sight of the fact that every doctor and nurse, and along with all the medical staff, even administrators, you're right there with us. You're going through this. You have personal lives as well. You have to return each day to your family, or want to return to your family. In some cases, we've heard of people that can't because of their compromised situations. So share with us a little bit about your personal experience in the last 9 months. How has this impacted you and your family, and how are you dealing with that?
Yeah, it's been honest horribilis, that's for sure. And so, I early in the pandemic, I was focused like a laser on, making sure that our network, our health system, our sites were safe places for our employees to come to work and safe places for our employees to get care. I personally was involved with testing early in the mitigation strategy, and I was so focused and dedicated on taking care of my community and my patients and my organization and our employees that I got home from work one day and I realized my family was really worried about me. They would see me go and they see me come home again, and they would be like, "Are you okay? Are you putting yourself in harm's risk?" So I made a commitment that as much as I love my organization and my patients, I love my family too. And so I've made a commitment to take good care of myself and to follow the rules. And when I'm out in public and when I'm out doing testing, to wear the PPE, because I don't want them to worry about me. They love me, and their support and love for me gets me through every day. And so I made a commitment to kind of take care of myself so that they don't have to worry about me. And so that's kind of been, part of my mantra. And I'm a big believer in self-care. This has been a stressful time for all of us. And, finding joy in, every possible way is important more than ever. Taking time to go outside and enjoy nature, finding happiness, kindness in, the acts of others goes a long way to helping me recharge my battery so that I can get out of bed and come to work the next day. I don't know what the sunrise was like in Venango County this morning, but I showed up to work. I had a morning meeting at 7 a.m. and I was sitting at my desk and my window faces the east. And it was a spectacular sunrise. I mean, it was just, it's been a long time since I've seen a sunrise like this. And I thought, you know what? That's a sign that, it's going to be a good day and it's going to be fine.
Yeah, each of us that have the opportunity to see that sunrise, that's a reason to just be thankful first thing in the morning. What a perfect ending to our session today as we enter the Thanksgiving season. I, like you, am blessed with great family, with a community that is second to none, with resources to meet my needs. So we're just so fortunate. I thank you for giving us the time today. This has been a blessing for me, and I hope for those who were able to participate with us today. I think we've gotten through all of my questions. There are no others on Facebook, but we'll welcome the chance if we get a chance to meet with you again. That would be wonderful. We can do some follow-up, maybe on a couple of the infographics that we talked about with the timing. I want to give a kind of shout out to my behind-the-scenes staff. Ashley's out there helping us make it through this, and Val Perry. And of course, I know that you have a great staff there too. Rebecca Dean has been helping me arrange this. So we're going to end in just a minute, but I want to remind everyone that as your chamber, we'd love to find ways to get you the information you need. We're happy to do more town halls. If you have topics or guests that you think that we should have, we can arrange for more of these in the future. Just reach me here at the chamber via email or a phone call. I'm going to ask you not to stop by right now. We are trying to stay safe and isolate as well, but we would love to host as many informational sessions as benefit our community. So again, we've recorded this. We'll share it out on our website, on our social media. We were Facebook Live. So with that, I'm going to ask Val, if you'll just go ahead and complete our Facebook Live. And Dr. Garrow, if you'll stick with me, I'd love the chance to just chat with you a minute or two at the end of our session. So thank you, everyone, for joining us today. And with that, we will sign off.